So climate change is not just an environmental threat, it's a growing health crisis. And with the rise of temperature, they're also expecting a spread of infectious disease like dengue, malaria, and putting millions more at risk. Heat waves and extreme weather also disrupting like food system, leading to widespread hunger and malnutrition in multiple areas. Vulnerable population also facing increasing exposure to life-threatening heat, floods, and air pollution. Hence, climate change is exacerbating health inequalities and creating global health emergency. So the objective for today's presentation is for me to present basically what other HISP group all around the world is working on climate health. We also introduce DHIS2 climate app, just like a brief introduction of what the app can do and what it looks like. And lastly is how we can best collaborate within our Asian Pacific region on climate and health. So we'll talk a bit about like how can we discuss and collaborate. Yeah, so this is the work that we have done so far in terms of climate health from other HISP group. So this is one of the examples of what we call a climate-informed early warning system. So one is we have infectious disease, namely vector and waterborne disease. So this is an example from Mozambique, from the malaria early warning system. So what they do is that they use weekly aggregate data they already have in DHIS2. They also mix it up with climate data. It can be local or global sources. So for Mozambique case, they get Copernicus data set and they put it through Google Earth API into DHIS2. Then they will use predictive modeling in external application. And then they will put the result back into DHIS2 to visualize on the dashboard. As you can see in Mozambique, they have created a map to visualize which area is highly affected by malaria. Other one is on nutrition and food security. So this is an example from Malawi. So Malawi, they have DHIS2 based national agriculture information system. So what they have is that they work with the Met department in their country. So the Met department in their country, they have their own weather station and satellite data, right? However, they lack local weather data. So what they do in Malawi is that the local staff, they have their tablet using customized app to collect local weather data. And then this local weather data is also sent to the Met department so that they can triangulate the local data, the satellite data and data from weather station for the Met department to do analysis and to warn people if there is a flood or drought to secure food, nutrition and food security. We also have an example from Rwanda in terms of climate and malaria early warning system. I apologize that our graph may be too little for those who are here, but what they're doing is that they are triangulate precipitation, temperature and humidity to improve data analysis. So you can see on the top, I'll just read it out for you. So the top is they are comparing humidity data and malaria case, and at the bottom is precipitation data and malaria case. Okay, since I'm from Laos, so I will present it a bit and emphasizing a bit about the activities that we have done. as at Q3 this year. So in Laos, as Dr. Visit has already presented yesterday, we have developed a national adaptation plan and also health national adaptation plan, which we call in short HNAP. So HNAP is what the government has been created to address health-related issue caused by climate change. And one of the crucial components of HNAP is to strengthen health information system to better monitor and respond to these climate-sensitive issues. So we start off by our pilot project. This one we work with WHO Laos. So WHO purchased 5-year data of climate. We have rainfall and temperature, and we imported it into DHIS2 to compare with dengue cases. So in Laos, we have incident-based surveillance, and we are able to get number of dengue cases daily. So as you can see, the blue area graph is a number of dengue cases, and the red is the amount of rainfall. So we found that there are correlation between climate factors and reported dengue cases, namely if there's more rainfall, more dengue cases. So from this pilot project and the development of HNAP, which launched on mid 2013, I believe, it promised to further strengthen our health information system to maximize the use of climate and health data. So from what we do, we decided to draft some concept notes. So we want to try to do some work among these areas and to see if we can produce any significant result to deal with climate-related health issues. So our first project that we try to do is as same as what we did or already doing in Africa, but we are more focusing on dengue. So the first project is on dengue outbreak prediction. So instead of importing climate data, we are trying to find a way to automate climate data input from Met Department into DHIS2. So the Met Department, they have a inflow of climate data from their weather station, from satellite data. We are looking for just the daily data for now. And then after we have those data in DHIS2, we will use the model called EWAS-R model to forecast dengue cases. So right now we are using external applications. So we extracted data, health data and climate data from DHIS2, and then we forecast. But I've talked with a team from Oslo that trying to put this model into the climate app, which I will present it soon. And then same as in Mozambique, we will create a DHIS2 dashboard to give out any outbreak indicators. So a health worker can use the data to tackle sensitive climate related issue. So the graph that we have right now, as you can see, the orange line is the number of cases. So these are actual cases. And then we have the blue line. So this is the forecast of dengue cases. We also have some forecast intervals area. So we predicted that the number of dengue cases would fall in the line or maybe in that area. We also want to develop a map on our dashboard as well to better visualize like which area will be highly affected or which area will have a significant dengue outbreak. Another project that we are working on is called Flash Flood Early Warning. So I've talked with a lot of the participants who are joining us today, and this year, many countries, including Laos, are suffering from flash floods in multiple areas, which had significant damage on like properties, as well as properties related or infrastructures related to health. So what we want to do is we want to integrate local flood forecast data from the Met Department, trying to put into DHIS2. So this the map that we is a mock-up map that we created. So we have you can see the plus side. So that is the health facilities data that we have on DHIS2, and you will see like the blue diamond. This one is also in DHIS2 is the warehouse for like vaccines and medical equipments, and you can see the blue area. So this the flood data, like flood risk area for 5 years. So you can see some of the plus size may be already affected by the flood. So this will help the Ministry of Health to better plan for stocking the health facilities or any evacuation plan so that we can avoid significant damages. And other initiative that we plan to do is research on addressing health issues caused by heat wave and heat stress. So this research will be led by Met Department in Laos. So currently we don't have anything to show yet because it's still in on research phase, but it's something that we want to do. Okay, so I will present a bit about the digital climate app. So this app allows you to explore and import temperature and precipitation data into your DHIS2 instance. So the data source for the DH2 climate app is called ERA 5 LAN, which is considered the most accurate and complete global climate data set available. You can use this app to explore the weather data directly on the app, or you can also import the weather data into DHIS2, and then you can use tools like Data Visualizer to compare climate data and health data for your needs. So I will show you some example of the visualization we have on the app. So this is the first figure, which shows the change in daily temperature in last year in Laos. And the second figure will show how monthly temperature has been changed over 40 years. And this is one of my favorite. So this is a 10-day forecast of any point of location of the health facility. So you can select the health facilities that you want to see, and it will show you a 10-day weather forecast. Another initiative of DHIS2 for climate health products is that we develop a data modeling tools which combines climate and health data for prediction. We call it CHAP in short. So what you can see is that we try to connect many systems. This can be climate data system, external disease surveillance system, and any external software. So they can bring these data together and going through a complex predictive modeling, and then we can send the data back to DHIS2 to support informed interventions on health. And this is the progress update of climate works. This is from Q2 this year, so there may be some changes. So we separated by the stakeholder engagement, also which countries have already engaged any stakeholder they have in their countries. So you can see some countries already held climate and health workshops in their country. Some are still on exploration stage with their stakeholders. And for climate app, in some countries that it is already operational, some is still in the dev instance, and some countries they are just demoed. So for more information on DHIS2 for climate health project or for the climate app, you can access on the link as shown on the presentation. There are also webinar as well if you want to to look at the video presented by our colleagues from other HIPS group. And for the last section of my presentation, I would like to present a bit about how can we collaborate within Asia Pacific region. So for HIPS group, you can contact me directly on how we can work together. I will be the main point of contact for Asia region. If you want to contact with on other regions, like for example in Africa, we have quite a regular regional meetings where each region will share what's going on and updates on what's happening in their region. So if you want to collaborate, so please feel free to reach out to me. And for our development partners or for other ministries in other countries, for country original level of engagement, you can reach out to HIPS representative that you know, or if you're not sure whether they are working on climate or not, you can also reach out to me, and then I will reach out to them to see if they can help you with the climate and health project. And for global engagement, you can also always email at climate@dishes2.org. So this will be like our global channel of contact for climate and health project. So yes, that's the end of my presentation. So I would like to now I would like to invite some of our colleagues to present on the climate and health work. So I would like to invite Dr. Meg from Nepal to come up on the stage to present his initiative on climate and health work in Nepal. Please. Yep.
Good morning and namaskar. It's my pleasure to be here, and thank you so much for the organizer for invitations. And my previous colleague has already set us, stage for a discussion on climate and health, so I don't have to go in detail. But I'll just share a climate change and health project in Nepal. I'm taking a case study of dengue. And in my presentation, I'll focus on climate change and health in Nepal, climate change and dengue in Nepal, and some progress sharing and way forward. Like my previous colleagues told, climate change is not anymore an environmental issue. It is a public health crisis, and it has been recognized globally. For example, recently Nepal has a flash floods. It was very unexpected, and like now millions of people are affected directly and indirectly. And of course, health is also affected. Means climate change will include the climate-induced disaster, as well as climate change affect the distribution of disease vector, also affect to the mental health, also to the non-communicable disease, also induce migration. That means there are huge impacts. So we need a system thinking approach to address all these problems in a holistic manner. But now I'll just take some example from dengue only. So in early 2007, we organized the first national workshop on climate and health, and which defined the major climate sensitive disease and risks in the context of Nepal, like vector-borne disease, diarrheal disease, including cholera, malnutrition, NCD, mental health, extreme weather-related effects, injuries. But I just bolded only first two because if somebody asks me the question, what are the impact in case of Nepal? We don't have evidence except for vector-borne disease and diarrheal disease. I mean, this is an area where there are very limited studies, not only in Nepal, whole, I'll say South Asia region. So normally in climate and health, we do the three types of research. First is the empirical database studies, and which may be learning the climate and health relationship using the past data like DSS2 data, or just having a cross-sectional study in the non-endemic area and detecting the impact and estimating the current burden. And finally, our aim is to protect the population health in futures as well as present. Means we have to design the adaptation strategy. For that, predictive estimation and modeling is very helpful. That means based on our current data and past data, we can project, we can do the forecasting, we can prepare for the future, like early warning system for heat wave, early warning system for dengue, etc. So these are some of the key findings from our previous studies on climate change and dengue in Nepal. We had several, entomological study along a altitudinal gradient, starting from the lowland to like 2,500 meter, and we have reported the disease vector have already shifted at least 2,440 meter above sea levels. And there is a significant relationship between climatic variables and abundance of disease vectors. Similarly, in an area where we reported a high density of mosquito, there is also the high incidence of the dengue cases. And we did also some social science study, qualitative studies, which also confirm the presence of disease vector in the recent year, which coincide with the climate change, warming trend of the last decades. Just to give the picture of the dengue situation in Nepal, we had a first case of the dengue in 2004. It was the imported cases in a Japanese traveler to Nepal from the lowland district in Nepal. And then in 2006, we had a first outbreak of the dengue with the 32 cases from 9 districts bordering with the India. And in 2010, it was another outbreak with one case from Kathmandu, which is located in 1400 meter, with the 97 cases and 5 deaths, first time deaths reported. And all the 4 serotypes exist in Nepal. We confirmed even in 2006 outbreak. In 2013, we had the outbreak with the 686 cases from 25 districts out of 77 districts. And in 2016, there was another outbreak with the 1,527 cases from 30 districts. See, in this way, it is gradually expanding geographically from lowland to highland. In 2019, it was the first major outbreak in the country with the more than 17,000 cases from 68 districts out of 77. And in 2022, another major outbreak after the COVID-19, largest dengue outbreak with the from all 77 districts, 54,000 cases and 88 deaths. In 2023, all 77 districts affected with more than 50,000 cases and 20 deaths. That means clearly you can see the trend, means expansion from geographically, rapid expansion from the lowland to highland, means all the hill and mountain are now endemic to dengue. And second, not anymore seasonal. The time, they are now perennial, means in all season we can see the cases of dengue in them. And I did just plotting of these, monthly cases, and it shows that, it highly correlates with the monsoon pattern in Nepal. Once the monsoon is start, and monsoon in also, dengue ins, means we can use the, precipitation as a, predictor to predict the dengue cases. So September is a peak time, and monsoon also in September, and after the October, November, then all the cases goes down. But still there with the sporadic cases. And we also did some analysis for the prediction in the future climate scenario in the different time periods. So it's also so increased risks of the dengue and malaria in case of Nepal. And we did some systematic review and meta-analysis which clearly show that the expansion of the dengue and dengue vectors along with other vector-borne disease is correlated with the climate change in the Hindu Kush Himalaya region, which starts from Afghanistan to Myanmar. And these findings are now also reported in the UN IPCC report 2022. And regarding the health sector response to climate change in Nepal, we did a first national workshop. Then climate change is now mainstream in the health sector policy and planning. Similarly, health is mainstream in the climate and policy and planning. We have also national adaptation plan for the 2021 to 2050, and the estimated implementation cost is 47.4 billion US dollar. And there is a specific component, health, drinking water, and sanitation sectors, and the estimated cost is 4.75 billion US dollar. And Nepal is one of the first countries in South Asia to develop the SNAP for 2017 to 21. And we have already updated version, and it is a costed action plan, and estimated cost is 7.3 million. But despite this policy response and other evidence, we have still so many gaps and challenges, right? First is the limited time series data available and inconsistent available data. Like we have a HIMS system, data come from DHIS2 portal. We have a early warning and reporting systems from EDCD, and there are other sources, and sometimes there is an inconsistency of data. That is one challenge. So we need a common portal. Second, there is a differences in spatial and temporal scale and units of data, right? And third one is very limited and sporadic research from, and most of the research are from personal motivation. We don't have the nationally representative or provincial representative studies. And very limited national level robust evidence, and sharing of data is also a challenge. I think it is a challenge of all countries, not Nepal only, right? And limited budget on climate and health. Still, this is a infancy stage. Globally, also like less than 0.5% budget could go to the health sector, climate and health adaptation fund. And just last year was the first World Health Day to celebrate in the UNFCCC conference of the party in Dubai. So, but there are the opportunities, right? First, use of the DHIS2 portal for time series dengue cases of district and the health facility level is possible. Similarly, we have a very long, like more than 50, even 100 years history of recording the meteorological data from the Department of Hydrology and Meteorology that we can use. Even in the DHIS2, we can record the daily cases of the dengue as a notifiable disease. And we have already a climate health analytics platform app, which can be customized to the Nepali calendar, and we can make a very good analysis, and we can predict to protect the population health. So basically in climate and health data, there are two major issues that we need to address to attract the interest of the policymaker. First, that must have a policy relevance, means data must be presented in a way that is accessible and relevant to policymaker and program managers to inform intervention timely. And second, there must be real data needs, means timely data are essential for rapid response, like what happened in the next month, what happened in next 2 weeks. If we can generate such evidence and communicate to the policymaker, I think they will demand. Means there will be the high demand, not only supply from a researcher side. So we take an opportunity of this global climate and health project, and we want to initiate this project in Nepal with objective to develop a robust DHIS2 based application for dengue surveillance and early warning system using the climate data in Nepal. And we first want to pilot this application to assess the feasibility with the aim of scaling up a broader and continuous use, taking the 3 districts from hill, Tarai, and mountain, and 1 district, Kathmandu as a valley. So as a progress, we have already done some time series analysis of the Kathmandu, and we share with the University of Oslo team, and it shows the highly correlated. That means we can use this observed data to predict. And then we have already started the stakeholder engagement and mobilization, and we did engagement with the key stakeholder. We recently organized inception workshop in the presence of Professor Johan Bra from University of Oslo, and we are building a partnership with the academic institutions and also research institute including government, so that it also enhance the country capacity for other diseases. These are some pictures of the inception workshops, and where the people from the Department of Hydrology presented, Ministry of Health presented, myself I presented, and also from University of Oslo. So it was a very nice one, and that there is a high level commitment with the presence of Health Secretary and Additional Health Secretary and others. And we have already selected the districts, right? And we have already sent a request to the DSM, and we have a MOU. So like my previous colleague presented about buying the data, but we don't have to buy now in case of Nepal for the government use. So that already exists. And these are the some study sites based on the last 5-year trend. We have taken from the lowland, Chiton and Tanau, from hill and mountain, and also Kathmandu. And we have already used the global data set, from this DHS2, and just analyze means there is a clear, pattern of the changing climate, with the April being the most warmest month. Due to time, I will not explain everything, but we see that there is also a very strong heat stress already in the lowland Tarai and the hill regions. So there is a clear trend of the heat stress in Nepal. And there is also, observed, warming trend in many months, right, using the global data set, but still we need to validate with the local data. And this is the precipitation one. So as a progress and way forward, what can we do means we have already upgraded the district health information system to the version 40 in Nepal to enhance the data management and integration capabilities. And we can implement the CHAP customized according to the Nepali calendar. That is also done, ensuring it aligns with the local spatial and temporal context. And now we are also developing a proposal within that project to document the facilitator barriers, so that we can scale up in case of other disease like the diarrheal disease or the malnutrition and other things. So we take this as a pilot study, and we want to generate the evidence, and based on that evidence, we want to scale up for the other disease and outcome in case of Nepal. Thank you so much for your time and patience. And if any question and queries, I'll be more than happy to answer. Thank you.
Yes, thank you, Professor Meg. So we are a little bit short on time, so we would like to invite our colleague from Sri Lanka to present it on their climate and health work. Please.
Right. Good morning, everyone. I'm Pramil Lianage, representing Ministry of Health, Sri Lanka. So I'll take you through what Sri Lanka has been doing on analysis of climate health data with the health data. Most of these interventions we have started very recently, and we are still on the initial phase of this intervention. So I won't be able to give you any outcomes, but I will describe the processes and the initiatives we have taken. So the request was initiated from the Ministry of Health, and they identified the requirement of this analysis of climate health data. And then since we are using DHIS2 for a lot of programs in the Ministry of Health, we have identified DHIS2 as the tool for this analysis also, because of the new climate health app. And then we, Ministry of Health, requested support from HISP as the expertise in DHIS2, and a formal request was sent from Health Information Unit of Ministry of Health to HISP, and then collaboration with HISP Center in University of Oslo was also initiated following that. And collaboration with Department of Meteorology of Sri Lanka was also initiated to obtain climate data, local climate data. And we have initiated a lot of pilot cases, which I will go through. So the local climate data from the Department of Meteorology, we have basically minimum and maximum temperatures, humidity, wind speed, and rainfall data, which is collected from 23 stations, which has complete data set of in 23 stations, but data is collected over 400 locations, like the daily rainfall and those things. Then first case we started was on child nutrition. I think my previous speakers also mentioned about how nutrition is affected with the geographical data. So child nutrition data was obtained from the Family Health Bureau data set and also the nutrition program. And climate data was taken from ERA 5. And then we have started analyzing correlation between these geolocations, climate data, and nutrition data. So this has been already, it's ongoing, and we have done already the analysis, but there are a few challenges, because if you take like food, which is vegetable, fish like food, they come from outside the location of the patient or the child. So direct correlation is hard to express, but there are some correlations which we are thinking that will come out as results. So another barrier is this data of children are restricted to an MOH level, that is Medical Office of Health area. So we don't have the exact locations of these children, but it's the MOH area location we have in our systems. So that is also a challenge which when mapping. So this is one outcome graph, one graph we have already made using the climate data and the child nutrition data. As you can see, underweight children, severely underweight children among different age groups, and also the precipitation and temperature being mapped with this data in one particular regional directorate of health services. Right. The second use case is related to mosquito-borne diseases. I think the previous speaker also mentioned about this. So we have one big issue is the dengue in Sri Lanka. And also we have eliminated malaria, but we are continuing surveillance. So these two cases we have chosen as mosquito-borne diseases for analysis using climate data. So this is still at the planning level, and we have obtained the entomological and surveillance data from the epidemiology unit, and then the campaigns, the anti-malaria campaign and the dengue control campaign, and climate data from ERA 5. So what we plan is, we already know that rainfall, these things are associated and it's seasonal. So we already know the correlation, but we are trying to develop further models to detect any epidemics coming up and the magnitude of these things, and which areas like they would be affected mostly. So those kinds of analysis we are planning to do using this data. And then another one we have already started is about clinical data. So we are taking data from the hospital information systems. So we are using three sources for this. One is from the morbidity and mortality data coming from the electronic morbidity and mortality system. And then the other one is the hospital health information management system, the HHIMS, where we have OPD data, OPD encounter data. And the third one is the cloud HIMS, which is which is implemented at primary healthcare level, and they have registered patients over 2 million and over 150,000 clinic enrollment. So these are at primary healthcare level, and the climate data is from the local authorities and also ERA 5. So challenges in this hospital data analysis. the data is again limited to the hospital. We don't have the patient location. It's the hospital location we have. So sometimes the hospital catchment area is not very well defined, because if it's a larger hospital, people from outside districts even can come to those hospitals for advanced care. So it's a challenge to correlate the hospital location with the geographical data of the patients. And then, but this is better at primary care institutions, because usually the primary care institution catchment area is defined, and we get better results through this analysis. So that is another good point here. And also we have an issue with the data quality of these systems, because, for example, the OPD encounter, this system captured it as a text field. So it's very difficult to clean this data, because standardized coding is not used at the moment, which we are planning to implement soon. So you can see about 30% of the data have quality issues in this system. So those kinds of barriers we are trying to overcome. And finally, we are planning to develop a framework. So this is kind of research work which has been initiated. So the collaboration with the University of Oslo by Ministry of Health and University of Colombo has been already initiated. So we are planning for a research, and this outcome of this research will be a framework on using climate health data, especially for policy level decision making. So this has also been initiated and is being ongoing. So these are the interventions we have planned and we have already started. So as I said, I don't have any results at the moment, but probably for the next year conference, we can come up with some good results. So thank you very much for listening.
Yes, thank you, Pramil, for your presentation. So we would like to move on to our next session right now. So apologize, due to a short on time, we couldn't receive any question from the audience. So please write down your questions and reach out to us presenters during the break or lunch. Thank you for understanding. So now I would like to move on to our next session, which is DHS2 for immunization in Asia. So to start off this session, I would like to invite Sam to present on immunization in Asia region in Laos.